Hi, my name is Dr. Athena Ramos, and I'm an assistant professor in the Department of Health Promotion at the College of Public Health at the University of Nebraska Medical Center. I work in the group called the Center for Reducing Health Disparities. I have almost 20 years of working with communities around health disparities issues. Today, I'm going to spend some time talking with you about health disparities, public health, and about how research can help inform efforts to improve health equity in communities. According to the World Health Organization, health is a complete state of physical, mental, and social well-being, not merely the absence of disease or infirmity. But for too long, we've defined being healthy as simply not being sick. Health is a state that allows us to cope with the demands of daily life, and it's a fundamental human right. Most people tend to think that their health is determined purely by their biology or their genetics. Sometimes we may think about drinking or smoking, maybe doing some physical activity or eating right. But what we know is that health is determined by many factors. There's 4 categories, you could say: socioeconomic factors, physical factors, health behaviors, and health care. What you can see from the infographic on this screen is that healthcare makes up only a very small percentage of what determines our health. In fact, only about 20%. And about 50% of our health is determined by our socioeconomic status and the physical environment where we live. One may also make the argument, though, that health behaviors are also driven by our socioeconomic status and the physical environment where you live. So you can see that these factors, the socioeconomic status and these physical environment factors, can have a large role in determining our health. Think about this example. Let's say you live in a lower income neighborhood. In that neighborhood, you may have less access to quality jobs. There may be limited access to higher education or technical career training. Parents may be working multiple jobs trying to make ends meet. Kids may be left alone at home while the parents are working at those multiple jobs. And everybody is under a lot of stress, which puts a lot of pressure on those families and those individuals who live in that community or in that neighborhood. The neighborhood itself may have some real or perceived safety concerns. It may have more crime potentially. There may be retail outlets that sell a lot more unhealthy food options like junk food, or maybe they sell more alcohol and tobacco, or there may be more advertising for all of those products in that neighborhood. But what you can tell is that these individuals in this community, they're at a disadvantage because health and wealth are connected. And we know that there's a social gradient in health all across the world. Doesn't matter where you are. The evidence shows that in general, that the lower your income or your socioeconomic position, the worse your health. We just talked about a number of factors that determine an individual's health. But an individual is also part of a larger community. And the health status of each community is also determined by a mix of factors, including physical, social, and cultural factors. For example, with physical factors, you might think about issues with geography or environmental concerns, or even the size of the community and the types of industries that are present in that community. In terms of social and cultural factors, we may think about the beliefs or the traditions or the practices that people engage in. We may think about the political structure or the economic structure of that particular community. And we may also think around social norms and how communities are organized. According to the Centers for Disease Control and Prevention, health disparities are a particular type of preventable difference in health that is closely linked with social, economic, and/or environmental disadvantage, which adversely affects groups of people who have systematically experienced greater obstacles to health based on a variety of factors, including race or ethnicity, geographic location, socioeconomic status, and age, among others. Health disparities They arise from structural inequities in the distribution of power and resources. These are not the result of individual choices or just a random occurrence that happens. Health disparities are the result of the historic and the ongoing interplay between structures, policies, and norms that shape our lives. Health disparities are serious, and they truly are a matter of life and death. Health disparities not only affect the group that is experiencing the disparity, they affect all of us. Health equity, on the other hand, means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing the obstacles to health, such as poverty, discrimination, and their consequences, including the powerlessness that people feel and the lack of access to good jobs that have fair pay, quality education, housing, safe environments, and healthcare. Health equity is the ethical and human rights principle that motivates us to eliminate health disparities. Health equity can be viewed both as a process and as an outcome. Now let's talk about a couple of specific examples of health disparities related to the Native American or American Indian community. You may know that American Indians have long experienced lower health status than other Americans. In fact, in a recent report that came out in 2019, they found that on average, American Indians lived about 5.5 years less than the average for all Americans. So you can compare the average life expectancy for an American Indian person is 73 years old, but for the general US population, that average is 78.5 years of age. So there gives you a quick example of health disparity. Some of these disparities can be related to the inadequate education or perhaps to the disproportionate poverty that's experienced or discrimination. But these are really broad quality of life issues that are rooted in economics and they're rooted in poor social conditions. The top 5 leading causes of death for American Indians are heart disease, cancer, unintentional injuries, diabetes, and chronic liver disease and cirrhosis. But compared with whites, American Indians experience significantly higher death rates for all of those top 5 leading causes of death. And the largest disparities were for diabetes and for chronic liver disease. Another example of a disparity comes from a 2018 report from the U.S. Commission on Civil Rights, which found that there was a big discrepancy in funding for healthcare services between the IHS, or the Indian Health Service, and the national system. And what they found is that within the IHS system, they were spending about $3,000 per patient or per person, compared to about $9,000 in the national system. So as you can see, these are just examples of some of the disparities that exist within this community. On this slide, you'll see a table, and in this table, it compares the mortality rates between Native American, American Indians, and the average within the U.S. And it gives you a ratio of how those compare to one another. So if you look at the ratio column, which is all the way on the right side, you'll be looking for any number greater than 1, and that will tell you that there's a higher death rate for that particular cause of death among American Indians. And you can see that for pretty much everything except for Alzheimer's, there's a higher death rate for each of those causes. Here we can see some of the disparities related to cancer incidence by race and ethnicity. And what we see for American Indians is that there's a lower incidence of cancer of the breast, lung, and prostate, but there's a higher incidence of colorectal cancers, kidney and renal cancers, liver, stomach, and uterine and cervical cancers. On this slide, what we're looking at is cancer disparities in terms of mortality. And what we see is that among American Indians, there's higher mortality rates for colorectal cancers, kidney and renal cancers, liver and stomach, uterine and cervical cancers. So all of the cancers where there was a higher incidence rate, there's also a higher death rate. Now, these are just examples of some of the health disparities that exist. Unfortunately, there's a lack of data that exists for American Indians on many different health issues. What we find in a lot of the health disparities data that exists is that there's comparisons between whites and blacks and sometimes Latinos or Hispanic people. But to find data on American Indians for some health issues can be quite challenging because it either doesn't exist or it's difficult to come by. Public health can be part of the solution to reducing and eliminating some of these health disparities. According to the Institute of Medicine, public health is the activities that ensure the conditions in which people can be healthy. The activities can include community-wide efforts to identify, prevent, and combat threats to the health of the public. Public health takes a proactive and a preventive approach to focus on the health of the entire community, the entire population, while we're still healthy, before people get sick. So just as a doctor treats a patient once they are sick, public health treats entire communities. We try to keep people healthy before their health fails and before populations suffer. In 1988, the Institute of Medicine defined 3 core functions of public health that have to be carried out in order for the public health system to work effectively. The 3 core functions are assessment, policy development, and assurance. Assessment is knowing what needs to be done. Policy development is being part of the solution to actually get it done. And assurance is making sure that it does get done. There are 10 essential services within the 3 core functions of public health. So if you look at the slide, you'll see the circle with the 10 essential services listed. So we start at monitoring health status to be able to identify and to solve community health problems. We diagnose and we investigate health problems and health hazards that may exist. We inform and we educate and we empower people about various health issues. We mobilize community members and partnerships for action so that we can solve these problems. We develop policies and plans to support both individuals and community-wide efforts. We try to enforce laws and regulations that may exist already to protect the public health, and we link people to the needed personal health services and assure the provision of healthcare when it's otherwise unavailable. We also assure that there's a competent public and personal health care workforce, and we evaluate the effectiveness and the accessibility and the quality of both personal and population level health services. And of course, we conduct research to try to figure out new insights and innovative solutions to health problems. So public health overall is something that can save money, it can improve the quality of life, it can help families to thrive and really reduce the suffering that people may have to go through. Reducing health disparities is a major goal of public health. In fact, eliminating health disparities, achieving health equity, and improving the health and well-being for all is one of the major overarching goals of the framework for Healthy People 2030. So a public health approach is one way that we can do this. A public health approach is one that must take place in the context of a balanced community health system. Now, that doesn't mean just a hospital system within a community or a clinic system within a community. We're talking about a community-wide system that includes both health promotion, disease prevention, and early detection, and it helps us move towards a system where everybody is able to access care and access health information. So this public health approach is one where it doesn't really matter what the topic is, it's the way that we think about working towards solutions. And so it usually consists of 4 general steps. The first would be defining and measuring the problem. The second is determining the cause or the risk factors for that problem. The third would be thinking about how can you prevent or how can you fix that problem. And finally, we would be implementing effective strategies on a larger scale and then evaluating for impact. So if you look at the slide, we'll work our way across the 4 questions. So the first question that you see is, what is the problem? So we try to identify what is the problem using health surveillance and data. This is why it's important to have data available, because that's how we're able to diagnose whether or not there is an issue that exists. So once we've identified the issue, then we move on to the next question. That is, what is the cause of that problem? And we try to identify some of those risk factors that may exist, like what makes certain populations more susceptible? Is it something in the environment? Are there certain behaviors that people may be engaging in that put them more at risk? And so we try to think about some of those things. Then we move to the next question. Well, what is it that works? So once we know the problem, we know some of the reasons why that problem exists, then we would think about what have we done before in this situation? What does the research tell us from other locations that might be a good approach to take? And we try to see if we can figure out, a set of strategies that is going to be effective in addressing that issue. And then finally, we move to the last question, which is, how do you do it? And so we try to figure out how we're going to actually implement some sort of intervention to address that problem. So you can see that in those 4 questions, we move from the problem to a response. And that is the core of the public health approach, is using data, using knowledge to try to move us towards an effective response that is going to help us to mitigate that health problem in our community. I believe that a really important part of a public health approach is to not only diagnose what's wrong, but it's to diagnose what's going right. Because we know that all communities have strengths, they all have assets, and they're each unique. So it's important for us as public health practitioners to be able to engage with communities, to understand what are those things that we can capitalize on for improving the health or fostering well-being throughout the community. Like, for example, with Native communities, some of the assets might be the vibrant, rich cultural fabric, or it might be the family-centric values, or that collective sense of we, that sense of community and belonging that people feel. That's also very, very unique. Or the fact that there are traditional healers and there's traditional medicine. Those are all things that can help us to promote more of a culture of health among our communities. Tailored approaches to reducing risk factors and promoting protective factors are some of the things that are needed. So we need to have good data, but we also need to have good connection with the community to understand kind of the undertone, the fabric that holds people together and holds them accountable for what's going on, and using that to promote the well-being throughout the entire community. Here you can see a pyramid, and I really like this pyramid because it's about how we can work through a public health approach to have a greater impact. So at the top of the pyramid, you'll see counseling and education, and you'll see clinical interventions. At the base of the pyramid, you'll see socioeconomic factors and changing the context of the environment to make the default decision a healthier decision. And so if we're serious about moving the needle on health disparities and really eliminating those disparities to achieve health equity, then we've got to make sure that we have interventions that are addressing the base of the pyramid, because that's where we're going to have the greatest impact within the population. At the top of the pyramid with counseling and education, those are all good and important strategies, but they are very time consuming, they can be very costly, and you're only reaching one person at a time. Whereas at the base of the pyramid, on those other strategies like addressing the socioeconomic factors and the context to make healthy choices easier, those are things that are going to affect more people. So we're going to get a bigger bang for our buck, you could say, if we engage in some of those strategies. Let me give you an example of how this might work. Let's think about tobacco. So if I start at the top of the pyramid with counseling and education, I could provide cessation counseling to somebody who smokes and is interested in quitting. That's very important. I go individual by individual trying to help people quit, and that's very admirable, but it's very resource intensive. I can't talk to everybody. I won't have enough hours in the day to make it through everybody who I would need to talk to help them all quit. But what if I put all tobacco products behind the counter and out of the reach of children? This is a strategy to try to change the context. We know that when we put tobacco products behind the counter, it makes it harder for young people to get their hands on these products, and therefore it can prevent young people from starting to smoke in the first place. What if I worked with my city council or my state legislature, though, to pass a smoke-free workplace law? So to make it smoke-free in every public building, every workplace, restaurant, bar, hotel, you name it. We made it all smoke-free. That's another opportunity where we're changing the context of people's lives. So you don't have to make the choice of whether you're going to sit in the smoking section or a non-smoking section. We've already made that choice for you. And that's one way that we can promote a very healthy environment for everybody. And what if we even go a step further? What if we tax tobacco products and really address the socioeconomic factor associated with smoking? We know that if we increase the price of tobacco, we'll have fewer people who actually smoke. So this is another strategy that we could use to try to change the number of people who are smoking and the number of people who are exposed to secondhand smoke. We know that these are all important strategies, and if we put them all together into a more comprehensive approach, we can have an even greater impact than if we just pick one strategy over the other. But if we can only choose one strategy over the other, we should choose the ones that are farther down the pyramid. So looking at tax, or looking at the smoke-free workplace, or putting those tobacco products behind the counter. Here's another example. Think about healthy eating. So we probably have all had enough classes and enough education about what we should be eating. But does that necessarily change our behavior? I don't know about you, but I don't always eat as healthy as I should. So what else could we do to promote healthy eating? Well, let's think about the retail environment. So think about your neighborhood store. Usually what are the first things that you see when you walk into the neighborhood store? It might be soda, chips, maybe alcohol, tobacco. Those are things that you normally see. But what if we change the context of the retail environment and put healthier foods more up front where people are likely to see them? So instead of having to trek to the back of the store to find the milk or to find maybe a banana or something like that, we put those up front. So those are the first things. We're making that default choice, the healthy choice, up front for you. And so that might change what you crave. Instead of craving a bag of Doritos, maybe you're craving that bottle of milk. Or what if we take it a step further and we think about a soda tax, so that we make it more expensive to buy the soda than it is to buy the water. These are just ideas for how you can use this pyramid of impact in your own work. And you can see that when you change the conditions, you can have a greater impact on the community. We need to track individual, community, and population level data on the determinants of health, because we know that data can improve our efforts to achieve health equity. Data can help us to make better decisions at a local, state, and national level. It can also help us to enhance the quality and the efficacy of the services that are provided by community organizations and healthcare institutions and other stakeholders. And we know that having data can help us to assess our progress and help us to identify what are those areas where we need to continue to grow and develop. On this slide, you can see the spectrum of translational research. When we're looking at health, we have research that ranges from T0, looking at the basic or the bench sciences, all the way to T4, which is looking to that translation into community or that population level research. In public health, we tend to focus mainly on the T3, which is looking at the clinical outcomes, and the T4, which would be more of those population level outcomes. Now, health disparities research is goes across the spectrum. There's people working at all levels on health disparities research, everything from genetics all the way up to community intervention. Let's focus in on T4 for a moment, because T4 is really a growing field. And I think a lot of public health practitioners and researchers are here on the T4 side. This is an opportunity to engage lots of different people in health research. In fact, T4, or that population level health research, is an interdisciplinary field. You can take my case, for example. My PhD is not in public health. My PhD is in family and community studies, but you can see how someone with my background could be a benefit to public health. Now, on this side of the population health researchers, we try to characterize and explain and influence the different levels and distributions of health that are found within populations. We use lots of different methodologies, lots of different theories, and we address lots of different health issues, and we take it from the perspective of our own discipline. And so it brings a very unique research environment to work in, because you're dealing with people from all different perspectives and all different backgrounds and experiences, all trying to address the same problem. Public health research generally addresses one of these 5 areas. First, it may measure or assess the problem. So we do a lot of surveillance type of work. Second, it might be to explain or understand what are some of the causes or determinants of the problem, and trying to figure out if they're biological or related to the environment or related to social factors. And so trying to think of the risk factor analysis. Third, we might be developing solutions or interventions. We do a lot of intervention work. Fourth, we might be looking at implementing or delivering solutions or programs and policies. So we do a lot of dissemination and implementation science work. And fifth, it might be related to evaluation of some of these programs. And so these are some general areas for you to think about when you're thinking about public health research, and how we can use some of these strengths of public health to address health disparities. Public health research addresses a number of concepts which are relevant to our discussion on health disparities. So of course, the research addresses the disparities. So looking at the difference between outcomes in different groups, or rates between different groups. We look at inequities, and so looking at trying to figure out if the rates are due to some of the differences related to, let's say, socioeconomic status or to healthcare resources. We look at inequalities as well, and so looking at how things are distributed among groups. And finally, we look at the burden and try to figure out how many people are actually affected and impacted by the health issues that we're addressing. In 2010, I was part of a team at the university who hosted a one-day conference to bring together academic researchers with tribal communities. The idea was to be able to exchange ideas through a dynamic forum where we could talk about research and how we can collaborate better together in the future to build a more sustainable network within the Midwestern region. And what people told us when we asked them about research and how we can better collaborate is that they told us we needed to build relationships. Do that first. So spend time getting to know people before you ask them to do some sort of work together. They talked to us about the importance of acquiring knowledge and skills and abilities which may be different when working with tribal communities, or maybe thinking about the different processes that you may have to go through. Perhaps there's a tribal IRB, or you have to have permission from a tribal council. So getting to know some of those systems before you come in with an ask. They talked to us about participatory and collaborative research and making sure that research was something that everybody could have a mutual win on. So it wasn't just that it would benefit one party, but the research should be something that could benefit all. They talked to us about sustainability and making sure that efforts are sustained over the long run. So instead of helicoptering in, doing the research and helicoptering back out, that there needed to be a commitment to a more long-term and sustainable relationship. They talked about the importance of having cultural understanding and really building trust with the community in order to carry out the research. And they talked again about the alignment of the goals and making sure that both parties, both the researcher and the tribal community, was able to have some sort of win-win in the research project itself and having an alignment on some mutual goals. And finally, they talked about the need for the community to be able to own the project. So these are some of the key themes that they talked to us about in terms of public health research with American Indian communities. Reducing health disparities and achieving health equity is really about building a culture of health. And the Robert Wood Johnson Foundation, which is a national organization, has been spending a lot of time and has been investing a lot into this concept of a culture of health. According to them, a culture of health is one which good health and well-being flourish across geographic, demographic, and social sectors. It's one that fosters healthy and equitable communities and guides public and private decision-making. And it's one where everybody has the opportunity to make choices that lead to a healthy lifestyle. The Robert Wood Johnson Foundation, in collaboration with the RAND Corporation, have identified 4 key areas of action in creating a culture of health. They are making health a shared value, fostering cross-sector collaboration to improve well-being, creating healthier and more equitable communities, and strengthening the integration of health systems and services. So first, we have to make sure that health is something that's valued by everybody. So we're all in this together. Things don't just happen in that part of town or to those people. They happen to all of us in our community. And so that's one of the key things that we need to do, is make sure that everybody understands that they need to be part of the solution. They need to be involved. Second, we've got to break down the silos that exist in our community and really bring together businesses in education and transportation and community development and other historically non-health sectors, because all of us have a role to play in creating a more equitable and a healthier community. Third, we need community settings and our policies to really support health and well-being, like giving access to health opportunities and making sure that those are equitably distributed across the community, making sure that there's resources available within our social environments. And fourth, a culture of health is really about creating a balance between both prevention and treatment, and it's about the intentional integration of public health with healthcare systems. So these are just a few of the ideas to really help us to reduce those health disparities that exist in our communities and try to move us more in the direction of health equity. I'd like for you to take a couple of moments and reflect on the things that we've discussed today. First, I'd like for you to think, why are health disparities an important area of focus for public health programming and research? Second, I'd like for you to think about a health disparities issue that exists in your community, and what are maybe 3 to 5 factors that may contribute to that issue, and why do they contribute to that issue? Third, I'd like for you to think about what type of information is needed to reduce or eliminate the health disparity issue that you identified as a concern in your community. What type of study should be conducted to obtain the information that's needed? And finally, I'd like for you to think about the idea of health equity, and what would it take to achieve health equity in your own opinion? Today we had the opportunity to talk about health disparities and talk about health equity and give definitions for both of them. I also gave you some specific examples of health disparities among the American Indian community. We talked about public health and what it is, what are some of the core functions, what are some of the essential elements, and what are the key elements of a public health approach. We also talked about research and how research could be integrated with a public health approach. And finally, we talked about a culture of health and how a culture of health can be used to reduce health disparities and achieve health equity. I want to thank you for your time today, for your attention. And on this slide, you'll see my contact information. So if you have any further questions, you can feel free to reach out to me. I'd love to be able to talk with you more about health disparities and about health equity and the work that we're doing at the University of Nebraska Medical Center in the College of Public Health to move those ideas forward.